Assalamualaikum warahmatullah and a very good morning, everyone. Sorry to keep you waiting. I think the COVID-19 pandemic has hit us all in a very big way, right? We have to do everything online and we have to adapt ourselves. And along with it comes a lot of challenges, right? And us not spared also. And we talk about COVID-19 every day, almost all the time. And we're trying to adapting to everything that we do. And a lot of work has been done to ensure that we may continue our livelihoods, but we do things differently. We go to work differently. We go out with our family differently. But there is still much to be talked about when it comes to children, how it's affected them, how it's affected us as parents. And so today, our first plenary, Educating Children and the New Norm, is most appropriate. And we have arranged for you today an excellent speaker to gain some insights into. It's my pleasure today to introduce to you one of my mentors who I hold very dear to my heart. So Professor Zabidi, Mohd Hussin, is a professor of pediatrics and pro-vice chancellor at the International Medical University, Malaysia. He graduated from the University of Newcastle upon Tyne in England in 1985 and pursued his interest in the field of pediatrics, leading to being awarded the Fellow of Royal College of Pediatrics and Children Health of United Kingdom. He returned in 1991 and served at the University Science Malaysia USM right up to 2016. He is currently a member of the Malaysian Medical Council and one of the member of expert panel in ethics for the European Research Agency since 2014. As an educator, he has inspired a great many students, myself included, who have gone on to be many things: doctors, specialists, consultants, researchers, and many others. I remember him as someone who always emphasized on approaching patients as person first, doctor second, so that you don't see a patient as a disease, but as a person to offer your best possible help. So it's a holistic way of looking at patients, as we all know now. As a pediatrician and teacher, it's very fitting for him to deliver today's first plenary, Educating Children and the New Norm. Before I pass on to the speaker, I would like to remind the audience that if you wish to ask the speaker any questions, you may do so by typing your questions in the chat box. Without further ado, Professor Zabidi, if you're ready.
Thank you.
The screen is yours, Prof.
Yes, thank you very much, Elsa. Thank you for the kind introduction. Ala Rasulil Kareem, Sayyidina Muhammadin wa ala alihi wa sahbihi ajma'in. Sidang hadirin yang saya muliakan, Assalamualaikum warahmatullahi wabarakatuh. It is an honor for me to be addressing IMAM Symposium today. It's a long time since I've been involved with any of the IMAM punya events. Like what Elsa said, I'll be sharing with you some of my thoughts on educating children during this pandemic, and I'll be sharing the slides now with you. Okay, can you see the slides now?
Yes, Prof.
Okay. So I can move on, yeah? So the title of this talk is, as given by the organizers, Educating Children and the New Norm, yeah? The new norm. So as of 29 November, this is the global view of the COVID cases. And you can see the screen here where most cases are, and America is leading the way in a negative manner. But I need to remind all of you that with all of this, we need to be aware of the fate of our children, and especially the fate of their education. A one-day miss in educating children will have a significant impact on their lives. And then also I'm going to tell you the an Islamic perspective of educators. These are the characteristics of educators from Islamic perspectives. And we are all educators, whether we are parents or whether we're teachers, whether we're academics, we are all educators, and we are educating the new generation, children from whatever age. Well, we are supposed to be mentors for their education. And some of the issues mentioned here and from Islamic perspectives are that educators must be calm and not hasty. Educators must be gentle. Educators must be loving. Educators must choose an easier path for those under his care. Educators must display extreme tolerance when dealing with children. Educators must avoid anger. And there is a hadith saying that a strong person is the one who is not strong physically, but a strong person is someone who can overcome anger. Educators are well balanced and reasonable in all actions. And all these values are very critical. They are critically important and are observed by children, especially during the formative stages of the development. And I'm sure the lockdowns and school closure will deny them of these opportunities, will deny them of interacting with their teachers and being shown the values of the teachers, okay? Because the brain is very powerful. The brain is so powerful that whatever you see and experience, the brain will record this. The brain will record this in a and it will play back all these memories. In one article, it is said that the brain has at least 30 million hours worth of screenplay. If you imagine brain as being a computer, 30 million hours of screenplay. So basically, whatever action you do, whatever things you're involved in, the brain will record, and it will record from teachers, it will record from parents, it will record from fellow siblings, and so on. So it's a very powerful way it's a very powerful organ. Okay, I'm going to move on now and briefly tell you the scope of my talk. I'm going to briefly tell you about the chain of events in Malaysia. It is no-brainer here because everybody knows the chain of events that happened in COVID. And I'm going also to tell you about the effect of lockdown, especially on education and of children in Malaysia and worldwide. And I'm going to share with you some experiences from the international community. And a very powerful study done by United Nations Population Fund and the United Nations Children's Fund, starting from 18th of March to the 13th of May. And this is a very, very powerful and distressing findings in 16 low-cost flats in Kuala Lumpur. I'm going to talk to you then about COVID-19 and what do we know about COVID-19, whether it affects children in a very bad way or otherwise. And what do we know about the transmissions of COVID-19 in schools? And then lastly, I will talk about the future of education in the midst of this pandemic. The chain of events in Malaysia, we all know, it started, the first case the first case was actually detected from overseas on the 25th of January. And 3 weeks after that, the first Malaysian was confirmed with COVID-19, a 41-year-old man who returned from Singapore. And then from the 17th of March, the first death was recorded, a 60-year-old from Kuching. And as of yesterday, these are the numbers that we have. And I think within 5 days, if the trend continues, within 5 days, this number will exceed 100,000. Okay, so this is the event that we're familiar of. And then from March, when the lockdown was introduced, to November 2020, we're talking about more than 1 million students affected. We're talking about 100,000 teachers and more than 20,000 members of school support staff are forced to stay at home. I have a son who's in Form 5, and he was saying that school was only open intermittently, and the maximum time it was open was only for about 2.5 months. And I was very interested to read the statement from the Parent Action Group for Education President, Datin Nur Azimah. She may be with us today. That 66% of Malaysian students do not have good internet connectivity at home. And during the lockdown period, 20% has lost interest in schoolwork and become demotivated, and 7% of all students have already dropped out from school. And this is also in unison with UNICEF findings that 24 million children around the world will drop out. And in the last slide of my presentation, I will give you a statement from the Minister of Education himself, saying that up to almost 40% of children do not own a device for online learning. All right, so these are some figures that are real, and we need to find out how these figures will affect children. Looking back on some of the publications, like for example, the impact of COVID among university students. University students are supposed to be mature, but still almost a fifth of them have minimum or moderate anxiety, marked to severe anxiety and extreme anxiety. And these stressors are mainly on financial constraints, on remote online learning, and on their uncertainty about the future of their academic performance and career prospects. So let's just see what happens internationally. There's a study in Italy on lifestyle changes, COVID-19 and psychological well-being of children and adolescents in Italy. And it is found that 20% of them of parents find it difficult to coordinate between homework and their children because everybody is sharing the internet. All right, this is also a problem that we face here. And 30% of parents reported an excessive use of social network and online games of these children. And the quarantine in Italy has been, the findings have been published and saying that a serious people who suffer from serious mental conditions, autistic disorders, and so on, are more affected by all this lockdown. And the same is learned from Italy, from Ireland, and even from Malaysia. We are familiar about the job loss and isolation. Now, there is a publication about 2 or 3 days ago saying that the increase in domestic violence and abuse and exploitation against children if they are at home. And this is an article I picked up on the 3rd of July saying that there is a 1,500% surge in child abuse. Which is a brutal and hidden cause of lockdown that should alarm the world. And this is happening in Ireland, published in the Irish Times. So really, it may be easy to say that just stop working, stop going to work, stay at home. It's easy to say, but the consequence of that can be quite dramatic. The first, as we all know, problem came from China. And they were the first to publish on the mental health status amongst children in home confinement. And they were saying that 180 million students were restricted to their homes. And of these, they reported a significant number of students with depressive symptoms, anxiety symptoms, and worried about getting the COVID infection. And the same happens from the USA also. And a third of the parents reported a worsening mental health, and 14% reported worsening of behavior and health for their own children. And the conclusion was the coronavirus pandemic has had a substantial impact on parents and children in the US, and many cities have documented an increase in domestic violence during this period. And this also seen in the latest study by the Child Mind Institute based in California, and which stated that a decline in the children's emotional well-being, 72%, decline in behavior and the physical health and so on. So really, in short, it has a problem. The lockdown has a big problem. So we must find ways of how to overcome the lockdown. And I will be telling you some of the ways that have been recommended by, say, the CDC later on in this slide today. There is a professor of economics which contribute towards a research-based policy analysis in Europe. And the title of his paper was Schools, Skills and Learning, the Impact of COVID-19 on Education. And it is found out throughout the world that the impact of school closures, a 12 weeks less schooling will have a 6% loss of skills. Okay, so even if you have a 12 weeks less schooling for the children, you will have a 6% loss of skills. of these children. So we really need to consider opening schools quickly, because we do not want kids to be losing their skills, and furthermore to be losing the mentorship of the teachers. Now, this is what I mentioned earlier. The UN Population Fund and the UNICEF entitled Families on the Edge. The study was carried out on March to 13th of May, involving 500 families in Kuala Lumpur, but in Kuala Lumpur's low-cost flats, involving more than almost 3,000 household members, and almost half of them were children. So I'm not sure whether people have seen this study before, but this is what it says. So the location of the surveys are in Kuala Lumpur, and this is the socioeconomic profile of the families. So basically, there is no price for guessing. The impact of COVID-19 on families have pushed more families into poverty. In these low-cost housing areas, 50% of them live in absolute poverty, and it is slightly higher amongst a household with children. And we know that there are quite a number of these families are headed by female. Okay, and the tendency is that when the family is headed by female, the impact is far worse. And also, the families which have disabled children is also worse. And I have a disabled child myself, and I see that the 9-month lockdown, even though I've tried to make her swim and so on, it's not the same, because she's beginning to have stiffness and so on, and that's not good. All right, and some of these families have pawned their valuables and have started to default on their rental payments, and because 68% of them do not have savings. Okay, so these are really a very, very big impact on them. And they have also noticed that 20% of the children have lost interest in the school, and almost 10%, the upper secondary ones, are just saying that I'm not going back to school, and being depressed. So again, this is something that we cannot simply ignore. Okay, some of the kids are back at school, but like you can see here, the number of children who says that they are not going back because I've heard of older children, for example, trying to assist their families by starting a business and so on and so forth. So this is a disruption, a major disruption on the schooling. All right, and there is one mother, a single mother who's self-employed, saying that during the MCO it was online, but internet connection was bad here. It was slower when everyone was online at the same time. And after the MCO and my son went to school, the teacher wanted to finish the syllabus quickly, so he was depressed because of this. So the desire to really finish off the syllabus for the sake of finishing the syllabus really has a very major impact on these children. That's probably the reason why they've started to say that I'm not going back to school. I would rather help my mom and my other siblings and to earn a living. All right. So these are the challenges for parents to keep them in school. Of course, some of the parents who are wealthy, who are able to pay tuition fees, they can pay tuition fees. But more than 60% of them have difficulties, and more than 65% find it difficult to provide pocket money, transportation fees, and so on for their children. Okay, so the mental health, again, I've mentioned this previously, mainly seen in the household headed by female, and it is quite depressing to see. And I know of my neighbors, who are led by female, because they're single mothers. They have major difficulties during this pandemic. All right. So I'm going to go through now an obvious, the online learning remains a major challenge if schools are closed again due to lack of suitable equipment. And most of these households, one being studied, they're relying on their handphones and fighting for the Wi-Fi, a single Wi-Fi in home. This is, and the majority of the parents do not want their children to learn online. Okay, so that's a finding. And I'm going to also alert you to a finding by WHO. This is published in November 2020, EpiWin, WHO Information Network for Epidemics. And the summary of it is that when we look at schools, there have been few outbreaks reported in schools since early 2020. So the outbreaks among school is quite a few, basically. And in most infections reported in children, the infection was acquired at home and not at school. And children who are less than 10 years old are less susceptible and less infectious than older ones. And closing school reduced community transmissions less than other social distancing interventions. So basically, should we open school during the pandemic? So that's a question that we need to ask ourselves. That's a question that we need to try and influence our policy makers. Now, we know that fewer children under 10 have antibodies compared to adolescents and adults, which basically means that fewer children under 10 had been infected. Okay, the infection that happens in school are not brought by the children themselves, but brought by people who have been exposed, adults who have been exposed outside school. And this is also the trend seen from China, from Italy, from Japan, from Singapore, Canada, South Korea. Basically, the susceptibility of COVID rises with age, and transmissions are also linked to age. The older you are, the more likely. And I think there was a study published in Lancet in Malaysia to say that the youngest it was a 34-year-old. And children under 10 are less likely to pass on the virus to others compared to adults and adolescents. Okay, and so this is a large contact tracing study in South Korea, and the study says that only 5% of contacts of children aged 0 to 9 became infected, the lowest for all groups, and suggests that young children are less contagious than older children and less contagious than adults. All right. So this should shape our policymakers to consider opening school and not closing it. And there is a strong link when the community transmission. There's an example here in Israel. In Israel where they opened the school. After they opened the school and they closed the school 10 days after reopening because they found there was a huge rise in the large outbreak in Israel because of the crowded measures with few crowded environment with few measures in place. So that happened in Israel, and also in Georgia, USA, where the situation was in an overnight camp, and that was the only large outbreak that happened in the school. So it looks as though if we have a preventive and sufficient protective measures in schools, it looks the chances of kids getting the infection from school is very, very low. Right? So it will have an implication on school public health policy. As I will recap this and say that the COVID-19 appears to have less effect on children's health. Children and school are unlikely to be the main drivers for COVID-19 infection. And closure of schools should be considered only if there are no other alternatives, okay, no other alternatives because of the issues that I've mentioned earlier, because of the impact it has on children, okay. And I will, like I said before, I will be sharing with you some of the CDC recommendations for school opening, and it is a no-brainer. I mean, it is a standard operating procedures to address the public health issues, okay. And we all know that, I'm repeating myself here, the school closures can affect children in many, many ways. Clearly, it affects their ability to learn. Clearly, it affects school-based services. For example, you immunize your children in school. You'll be surprised how many kids do not take meals at home, but they depend on school meals to get them going. All right. The mental health and psychosocial support, the anxiety lost due to peer interaction and the disrupted routines, and out of school increases, this is a report from the WHO, increases the risk of pregnancy, teenage pregnancy, increases the risk of sexual exploitation, violence, and other threats. And the harms are greater for children of migrants, refugees, minorities, and children living with families living with disabilities, and so on. And it is already affecting so many children worldwide now because many schools are simply not able to offer remote education or alternative strategies for learning. And keeping at home, children at home affects the ability of parents to work and introducing other risks for these children. Okay, so it is not on. And I remember reading Dato Musa's article on this with Dr. Tiaga, I think, and really when I opened the website for Page Parent Action Parents Action Group for Education, they quoted MPA as a society which do not advocate school closure because of all these reasons. All right. Here it is. This is an article published in May by Dr. Musa and Tiagar. Sir John Daniel went through this and tried to provide some mitigation factors if you have to close schools. He was saying that, okay, you may have to close schools at times during the time of severe outbreak and so on, but the reassurance, students have to be reassured through targeted communication, through person, not just the teacher saying to the class, don't worry, but through a personalized counseling to each child, and that's not quite easy to do. And because the counselors may be better than parents at alleviating the anxieties of the students, and we have to make special efforts to help students whose parents are unsupportive and whose home environments are not conducive to study. I have a feeling that teachers should do more to reassure the parents. Of course, they will find time to do other things, but I think what they should have in mind is just, how is my kid, how is my pupil doing at home? Reach out to them, speak to them, and that matters more than seeing the lockdown as another opportunity to do other things. Okay, and Sir John Daniel also suggested that the simple approaches to remote teaching, for example, recording it using asynchronous learning, and it will enable students to juggle the demands of home and of study. Okay, and also to make personalized online appointments with students with particular needs and allow the students to breathe. Okay, I don't see that here. Even I'm in Putrajaya here, I don't see that happening with my son, because the class will be a big class with everybody in the class, and I've never seen anyone reaching out to my son personally. Maybe because I think that I'm already providing adequate support for my son. So to support schools and to stay safe, it will involve community, it will involve school and classroom, and clearly it will involve individuals at high risk. So there is in July in 2020, there was a publication in England, I'm from England, on limited COVID infection in schools with good public health measures. Okay, so they published this on a mini term during a summer, June 2020, and the reopening of schools was associated with very few outbreaks when public health measures were in place, and there was and like I said before, it was the staff members who are at risk and not the children. So if you have a very good public health measures, rest assured that the kids will be safe at school. So that's the main message from this slide, all right? But as I mentioned to you before, if you have insufficient public health measures, there will be a large COVID outbreak. And I've given you the report already, which is published in Israel on 13th of March. They closed all schools and fully reopened on 17th of May. All right. There was minimum physical distancing and so on. And during an extreme heat wave, the Ministry of Health exempted pupils from wearing masks, and the windows were closed and air conditioning functioned continuously. 10 days later, sure enough, the COVID outbreak occurred in high school, and we have so many people, kids affected. So that's an unusual circumstances. It was insufficient public health measures in that particular instant. All right. So like I mentioned already, the CDC recommended, these are some of the, there's a long list of recommendations by the CDC, but these are some of the recommendations that's probably worth noting. They divide the risk into lowest risk, more risk, and highest risk. The more risk are small in-person classes, activities, and events. and students should remain 6 feet apart and do not share objects. These are things that we are already doing now. And the highest risk will be full in-person activities, like you saw before in the example that I gave you before, that there was a camp, and that led to the outbreak of COVID amongst the children in that particular school. And the CDC goes on to recommend that if you have to, we have to give kids meals, because often kids rely on school meals rather than home meals at home. Do this in this plated box or wrapped meals in classroom instead of cafeteria, and staggering the meal time to reduce the number of students or small groups within a cafeteria, and if necessary, install physical barriers such as sneeze guards and partitions. We have that in Parliament, but I think we should really consider doing this in school as well, because parliaments and school are two contrasting institutions, I think. So in my closing remarks here, I've gone through Malaysia's response on education of children during COVID. And the response has mainly been lockdowns, a gradual opening, and a major closing. Okay, we have shifted the SPM exam to next year, and causing a lot of anxiety to students. Students are having to take trial exams, and to their surprise, these trial exams will now be used as a criteria for them entering universities. Okay, and the trial exams, they sit in an environment where there was it was not a conducive environment. The Parents Action Education Group president, I'm quoted here to say that for the first 10 weeks of the MCO, the online teaching is noted to be ad hoc, random, unstructured, and even non-existent. All right, the first 10 weeks. And the timetable was only created in May, she was saying, but not strictly adhered to by teachers who are not familiar with technology. Okay, so this is published, words were published, a quotation was published in a newspaper. And clear enough, the Minister of Education, Dr. Muhammad Razi, concurred to this and said that during their survey, they were saying that almost 37% of about 900,000 students surveyed have no access to an electronic device for e-learning, while 46% of them have their own smartphone. Now, we all know the problems with smartphones. It's not an ideal device for learning, all right? Not an ideal device for learning. And so that's being admitted by them. And also, so I think what are those things in existence now? All right, as soon as the digital agenda was being absorbed fully by the Ministry of Education, there was this kind of online education that has been launched. One Bestari Net, the Edu Web TV by the MOE. They launched the Digital Educational Learning Initiative Malaysia. It's called DELIMA. I think Dr. Mazli started and enhanced the Google Classrooms. And there were other things as well, the SPM Flix and so on. But children, parents, and teachers need to be familiar and be trained all that, all right? So what I thought is needed moving forward is that we need to start, because the digital transformation in schools is now the future, although physical attendance is still necessary. Perhaps we should have a school digital starter packs consisting of tablets, which cost about 300 ringgit, a laptop maybe, or either one, which costs about 1,500 ringgit, a video cam, a noise cancellation microphone, 50 ringgit, a free internet for every families. In 2018, we have 2.66 million primary school students and 1.9, almost 2 million secondary school students. So if you put that together, it was probably cost 5 billion ringgit for the government to dish out these things free for all students in the country, and a 4 billion to dish out to all the secondary schools. Now in 2021, the Ministry of Education received the highest belanjawan, 50.4 billion. All right. So hopefully, I'm a bit late in trying to influence this. I don't have any influence anyway, but I think 5 plus 4 billion, 9 billion, as opposed to 50.4 billion is probably needed, and they can do away with that, and improve the level of the digital achievement, the digital issue of our students, and also to enhance the communication towers in the country. All right. So there is on the 26th of November in Sabah, 3 pelajar cari line internet jatuh dalam jambatan. All right. I mean, from in Putrajaya compared to those living in the. And lastly, the Professor David Nabarro, a special envoy on COVID-19 in WHO, says that WHO do not advocate lockdowns as a primary means for control of this virus. The lockdown is only for you to buy time, to think of a strategy, to regroup, to rebalance your resources. Okay, and Argentina, which has the longest, world longest lockdown, has failed spectacularly, and brought the country to economic collapse. Here, more people die from suicide, from depression, than from COVID in 2020, and more women have been infected. And someone called Eriko Kobayashi had tried to kill herself 4 times make 4 suicide attempts from the extreme stress of COVID and of being in lockdown. And just this morning, a man caught for stabbing his 20-month-old baby daughter. No details were given, but I presume the man is under so much stress. So in conclusion, ladies and gentlemen, the data shows that young kids aren't as susceptible to COVID as older ones, and staying at home leads to emotional changes. Staying at home leads to other more depression and more harm than good. And failure to continue education has very, very serious detrimental effects on the children. And we ought to consider and be a policy guidance to the government to continue schooling with careful SOP is the only way forward, because we simply cannot compromise on education, and maybe to start thinking about the digital starter packs for our children. And on that note, this may be the education for the future, this may be the classroom for the future. Teachers standing there, seeing all the children at home, but in the big hall, in the class, and they are actively participating. Thank you very much for listening. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Thank you so much for that excellent sharing, Prof. I think before this we were aware that things were not good, but I think after listening to your presentation, it really hits hard at how bad the children has been affected, particularly those from the lower income group. And it's particularly alarming, I think, this inequality that is building up because of what has happened. And I think we know that in private schools are going on as usual, right? Because everyone has access to internet, so classes are being held as per usual according to the schedule. Also, it's not, although it's not in the physical sense. But Prof, how do we mitigate the problem of fear from parents? I think there's a lot of fear on parents' side sending their children to school. The smallest news that there is a positive case or there is close contact, immediately parents will stop sending their children to school. Yeah. And even though there's no announcement from the school that the school is closed, nobody turns up in school. What are your thoughts, Prof?
Yeah, I think that is a problem of fear. In fact, that fear, when someone in KL Central had a contact with COVID, the whole KL Central was abandoned, and I think that's an overreaction to the fear, and I think this overreaction is understandable, but I think we need to convince them, we need to reassure parents, and we need to give a choice. If those parents who fear, they can have a hybrid model, they can stay at home, but each time the fear is alleviated, please come to class because the others are in class. You see, so I think we probably have to persuade them through that way. Okay, and have a hybrid, some in class, some physical, and some following on online. Yeah.
Yeah, I think that's excellent, Prof, because obviously it shows that lockdown is not the solution,
Yeah.
especially for our children. And I hope that that's one of the big take-home message that all of us take from the symposium today,
Yeah.
right? And I think we also have to be advocates of what is what we see in evidences and not deprive our children of education and good development. One more question, Prof. How do we, this is another fear question, right? How do we convince parents to bring children for vaccination, normal vaccination, because they fear that they're going to contract COVID when they take the children to clinics for vaccination? I think this is one of the questions posed by our participants.
Yeah. But parents basically have fear to take their young babies to the clinic because of fear for COVID. Yeah, that seems to be the question. Yeah, I think they will have to be convinced that the clinic has enough protection measures in place. I fear going to the dentist during the pandemic. uh, I was just scanning all the environment during that in that setting, and when I saw that there was so many things in place, the screening, the nurses were wearing the protective measures, the PPE, and my fear was just gone, because I said that with all these things in place, if I still get it, it's really fake, you know. So I think we really have to show the setting of the clinic and say that, look, all the measures have been taken care of. The nurses are wearing the appropriate PPE. The jab will be very, very quick. You know, the immunization will be very, very a quick injection. It will not be they will be in the open space. All right. And it will be less than a 1 minute interaction between the nurse and the baby. So I think we just have to perhaps let them come to the clinic, see the environment, and gradually persuade them to come, because the immunization issue is really a big one, and the harm from not immunizing will be more.
That's true, yeah. And we probably need to increase our visibility on what other measures are being taken in clinics, and to encourage parents to bring forward their children.
Yeah.
Another question, Prof. What about exposure to screen time in children? Do you know of any studies that have been done throughout the pandemic?
No, I don't know of any studies. I do not know of any studies. I can look out for you on some of the outcome of the name. But what I know of these are not scientific studies, but I know that kids, especially the older ones, are accessing materials which are not suitable for them during the pandemic, because they have access to the phone. I don't have data to it, but I think that may be a research that somebody can do. They're accessing materials which are not meant for them, and because they have the phone, all right, because they have it.
Indeed, Prof. That is a very real situation which is already going on, but we do need some real data. I hope someone will take it up.
But there is data, Elsa, from Italy. I did not show that data before.
Okay.
There is data from Italy saying that more children are exposed to online exploitation during this COVID. There is data from Italy. That one I know, yeah.
Okay. I think that is a major concern also, because parents are also very wrapped up in trying to cope with this new norm. They are working at home, but they don't really have time to monitor children on their devices if they do have. Okay, so we have much to do, it seems. I'm so sorry that we don't have more time to discuss. There's so many issues that we can discuss, but we can probably get more information after this personally if you want to. Thank you very much, Prof. Zabidi, for spending time with us today. And so I will pass back to Dr. Yusuf for the next event. Thank you, Prof, and thank you,
Thank you very
everyone.
much for the invite. I'm honored to be involved. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.